Hello friends, today we'll see how to code breast biopsy procedure codes. This is actually coded in percutaneous facility, percutaneous surgery known as IVR, where we'll code breast biopsy most commonly. So today we'll see how we can code these breast biopsy procedure codes and what are the things included in these CPT codes. So these are the list of actually codes which are commonly used, and it starts with 19081, 19082, 19083, 19084, 85 and 86. Now 81 and 82 are with stereotactic guidance. So first code is for initial lesion. For initial lesion we have to code the initial procedure code 19081. For each additional lesion which is taken during the breast biopsy procedure will be coded with an add-on code 19082. So this is only for stereotactic guidance. So based on guidance, different guidance, we have separate codes. So for ultrasound guidance you can see 19083, and we have an additional code 19084. Again, for magnetic resonance guidance, MRI guidance, we have 19085, then additional code we have 19086. So what does the description of all these codes says? Biopsy breast with placement of breast localization device, example like clip, metallic pallet, when performed, and imaging of the biopsy specimen when performed, percutaneous first lesion, including stereotactic guidance. So in this description they are including guidance code, and then they are including the breast localization code. This I will explain you with a sample chart at the end. Please be with this video. In the end we will see how we can code the breast biopsy procedure code. There you can understand what are these devices, localization devices, and how they are included in the CPT codes. So based on the guidance they have these 6 CPT codes, in which 3 are initial code, and for each additional code we have 3 CPT codes. So based on guidance we have 3 categories of codes. So 2 codes for one each category. My stereotactic guidance 19081 to 82, ultrasound guidance 1908384, and magnetic resonance guidance 19085 and 86. Now what is bundled and what is included in these codes? So already I told breast localization device placement codes 19081 to 86 are included in breast biopsy codes. That is given in description also, which is very clear. Again, imaging guidance, that is also very clear in the description they have mentioned, it is included. Mammography, this mammography actually when they use to perform to verify the clip placement. So when the biopsy procedures are done, we'll place one clip. So to verify that the clip is placed properly, that mammography will be done. So these are also mostly included in the biopsy procedure. Then we have breast lesion specimen imaging. So these are also bundled. This is code 76098. This is also included with breast biopsy CPT code, and this should not be coded separately. For open biopsies you can code this code 76098, but for breast biopsy codes from 19081 to 86, these are included. Breast specimen imaging. So again, now the main question is how these biopsies are coded. They are coded per lesion. Do not get confused whether it is done on right or left. It doesn't matter whether it's done on right breast or left breast. Only you have to count the number of lesion. If it's done most number of 2 lesions on one breast, or it is done on one breast on the other lesion on done on second breast. So you have to code the number of lesion only, and then you have to code. It doesn't matter on the laterality whether it is left breast or right breast. See here it says core needle biopsies are coded per lesion. The first lesion code or initial code 81, 82, 85 may be reported one time per session. If the lesions are biopsied in both breasts, report one lesion code and one additional lesion code. So it doesn't matter if it is done on both breast or in one breast only. You have to code the codes as per the number of lesions biopsied. Additional lesion biopsy should be coded only via separate skin lesion, skin incision. So if any separate skin incision is done, then only you have to count it as an additional lesion. Do not code like for any needle insertion or any simple process you can count it as a lesion has been biopsied. No, the separate skin incision should be done for any additional lesion to be coded. The codes are differentiated as first lesion and each additional lesion in either breast. The codes are based on the first and additional lesion, not based on the one breast it is coded and second breast. No, not based on the laterality. It is differentiated on first lesion and additional lesion. So if two lesions are biopsied on one breast, left breast, so you will code the same code with same guidance if they have done. And if same two lesions are done on one breast and another done is on the second breast, with same guidance you will use the same two codes. So do not get confused here. One second. Then again I am showing you here with one example. Like if one lesion is biopsied in left breast and second lesion is biopsied in right breast, with same imaging guidance we will code it as two lesions irrespective of left and right breast. So here it doesn't matter left or right, you will code one initial code followed by the second additional lesion code, and code based on the number of lesion and not based on laterality. So that is what we have discussed here. So do not report 50 modifier with breast biopsy code. This also you have to remember. Some payers may ask you to give left LT RT, that may be depending on the payers guidelines. Some private commercial payers may ask you to give LT RT with CPT codes, that they have separate guidelines, then you can follow it. But as per usual coding guidelines, we should not give 50 modifier with breast biopsy codes. Now here is a separate like coded breast biopsy code, medical report. Here I want to just show the documentation how the breast biopsy report is given for medical coders. So here you can see in the findings, in header they are telling that stereotactic biopsy of the right breast, post procedural right with CAD excision. So this is mammogram also they have done, I think. So here we'll see what is the guidance here they have used first. So here see I have highlighted they have done a dedicated stereotactic core biopsy. So we'll use code 19081, initial one here as per the description. So this they have done stereotactic core biopsy. You have to read the whole report. Since I have coded this report, so I can understand this is actually surgery report for breast biopsy. So this highlighted term you have to see if you want to understand the core report. So first we came to know that it is a stereotactic core biopsy. Now here you see they have done post biopsy marking clip was placed. So there is a clip placement procedure also done, but as we know the description says the breast localization device is included, so this clip placement is also included. Now again if you read the report, they say a post procedural and a mammogram demonstrate the buccal marker clip at the expected biopsy site. So this mammography, as I told, is done to see whether the clip was placed properly or not. So here the mammography is also included in the core biopsy procedure. So three things: one, clip placement; second, mammography; and the third is imaging. All are included in the breast biopsy code. So here you can see I have coded 19081, which includes all the procedures of this breast biopsy. So this is the way breast biopsy procedures are coded in IVR. So this is the short video for breast biopsy procedure codes. So I hope you have got clear your doubts regarding these procedure codes. If you like the video, do share it, and if you have any doubt, you can share your comments in the comment section, and do share this video to others to gain knowledge, and do subscribe to my channel as well to get more info about this topic in future. Thank you.